Welcome, Compounding World. This is Mike Lisio, North American Sales Director for PCCA US and PCCA Canada. We'd like to welcome you to a very special episode of A Mortar and Pestle, a video edition consisting of Sebastian Denison, our normal guest, as well as Amanda Cassel, our General Manager from PCCA Canada. This is a very special opportunity for us as Sebastian, myself, and Amanda are all native Canadians. We decided it was probably the best time to release Canadian-sensitive material to all of our PCCA membership base, as well as compounding pharmacies across Canada. Sebastian, Amanda, very nice to see you guys over video. Obviously, we're all in different places at this point. This was our best opportunity to record video material and to release information to our very wide audience. Over the course of the pandemic, since we've adapted as a company, we've done a series of member briefings. A lot of that content was squared, I would say, or positioned more or less for the U.S. market. This gives us an opportunity to discuss some Canadian initiatives, some Canadian things that have taken place. Given the fact that Sebastian is a member of our clinical services team and does serve a very large community as it pertains to compounding pharmacy in Canada, and given Amanda's experience north of the border as our lead manager within our Canadian facility, this really gave us the opportunity to sit down and talk about some best practices, some operational techniques, some things that have implicated Canadian pharmacies as it pertains to regulation, but mainly we are trying to do this to deliver information in a more positive manner and to try to obviously educate our base, as I mentioned earlier. So welcome to the video edition of A Mortar and Pestle. I'm calling it A Mortar and Pestle to all of our audience out there who is familiar with our podcast. Sebastian and I have the privilege of hosting our normal audio routine that resides on our audio platform as it pertains to iTunes or Spotify. And this is a bit of a different dynamic, knowing the fact that we have video material and information that we can share face-to-face. So welcome, Amanda. Welcome, Sebastian. You guys are going to be our guests today. And I'm going to try to kind of guide our audience and guide some of the questions that we've been getting north of the border to hopefully to fulfill the demand of some of the information that's required at this point.
Thanks for having me, guys. I'm very excited to be here.
It's kind of fun to be on the guest side of things, Mike, but I'll try and get used to the new role.
Well, you know what the funny thing is, Sebastian? All three of us at one point worked in that same facility on 744 Barons Way in London, Ontario. So it does bring back some memories to have all three of us in different places right now, but at one point all working together in the same office. So thank you guys for doing this. Sebastian, as I mentioned, I do have a few questions for you. Because as I mentioned, we did a series of member briefings. A lot of the information was either financial, regulatory, we discussed employment law, but we did also have an opportunity to touch on operational practice, operational techniques that pertained to compounding pharmacies, mainly compounding pharmacies who were trying to serve their patients in a very different way throughout the course of the pandemic. Many of them switched to curbside delivery, restricted access and restricted foot traffic within the pharmacy. What are some of the things that you've seen Canadian pharmacies do as they've been forced to adapt over the last month or so?
So it's kind of a fun one because we've always had an innovative position in practice as compounders. And to see the changes that are kind of happening across the world, meet an innovative group of healthcare practitioners. We've seen some really interesting changes in their practice and how they do their business, but also in still servicing the patient in need. And it was kind of anything from, like you said, curbside pickup to the adopting of new technology to just kind of everything. So I'm going to ramble a little bit about some of the things that we're seeing. But I also want to point out that in Canada, we've also got some other parameters. You can be in downtown Vancouver, high foot traffic, very little parking, and nice weather to say, I don't know, somewhere in Ontario where we were still getting snow through April. And so all of a sudden, the parameters to which they're trying to achieve these are still we're still getting some external environmental things happening. So really, really interesting practices. And I kind of feel like John Krasinski talking about some good news, because I want to give a shout out to all the pharmacists that are still working, still in the front lines, and have adapted and literally thrive in such a challenging environment. one of the first things that we saw was this step back from practice and finding ways to still have patients have access to pharmacy and pharmacy products without necessarily having that same physical contact space coming in. And one of the first ones that I saw was a lot of pharmacies, they developed signage and they would post it outside of their pharmacies. And they were the first to move. We didn't see corporations moving as quickly, but having a big sign on the front saying we're restricting access to the pharmacy. Here's a phone number. You can phone, text, or even pick up our regular landline. Let us know what you need. We have people in the staff. They will do your shopping for you. And so kind of a specialized niche of pharmacy practice. And at the same time, also developing, like you said, curbside pickup, but then people have expanded their delivery service. And I heard one pharmacy, they said they were going from about five pharmacy deliveries a day to over 60 in an afternoon, literally overnight. And so Canadian patients immediately heeded the request to isolate, but then pharmacies stepped up and started expanding their service significantly. Next thing, the changes in the actual prescribing patterns, extension of refills, filling of scripts, making sure that patients never had a gap in their practice. Every college and Health Canada have extended special powers at this time, and I've been reading all the bulletins. But this has even gone a little bit step further with patients with specialized compounding needs and making sure there was no interruptions in medication management, all the way through to these specialized niche practices of even methadone practices, where they were saying we have to still compound these specialties and making sure that they're still getting their daily witnessed ingestion. How do you balance an at-risk population of addiction and daily witnessed ingestion with, oh, by the way, we're in the middle of a pandemic and we can't come within 6 feet of each other, and how are you still going to get people to witness their ingestion of methadone? There's been some really unique practices that were already set up, and they did an amazing job out on the East Coast in finding a way to still smooth that transition and keep those patients serviced. We've even seen some people get out into the community and deliver directly to those patients, which has been amazing. Everything from shower curtains to plexiglass to, and our pharmacies were very uniquely positioned. They had PPE already on hand for their compounding practice. They literally were able to don it and just go out front and start looking after the patients. And I've even heard of some compounding pharmacies sharing some of their excess PPE with some of their other colleagues, as well as doctors' offices and other healthcare clinics. So we know that there's been a transition. And I'm going to let Amanda talk about a little bit of her involvement in that and making sure that their PPE got distributed. And then lastly, the biggest one was the hand sanitizer. Everyone from Health Canada all the way through the colleges, the compounding rules are still applying. You can't do third-party selling, but I'm almost positive I talked to every compounding pharmacy and a few other pharmacies out there that were still reaching out. Everyone's making hand sanitizer and following the legislation and requirements for concentration of alcohol, as well as making sure that the labeling laws were enforced, were followed. And everyone's making hand sanitizer and stepped up, and we're protecting the public in such a unique fashion. It is just like a world of bravos going from our world out to our compounding pharmacies that have just stepped up and taken over and been leaders in the healthcare profession. So love it.
What's been incredible to watch, really, as you mentioned, is how well pharmacies have adapted, but most importantly, the fact that they should not be forgotten, and knowing how near and dear pharmacists fall to us and how near and dear they are to our own hearts is that they are so important on the front lines, and they've done such an exceptional job. We've had amazing positive stories. I think you've alluded to a few of them, Sebastian, and they've truly stepped up. And they were, I think the best example of that is seeing the Prime Minister recognizing what pharmacies were doing very early on, as many people were sheltering in, a lot of quarantining, a lot of isolation was being recommended, yet pharmacies were fully operational to a certain extent. As you mentioned, curbside delivery, home delivery obviously being so important. How else have you seen pharmacies adapt? I've heard certain things around maybe condensed hours. I've seen split shifts. I think that's something that has been very common in many companies at this point is, different operational crews, especially with condensed hours. Is that something that we still see being practiced at this point? Is that something that we're still potentially not recommending, but maybe offering our audience as a best practice as we begin the next phase of integration?
Well, Mike, it's a really interesting dynamic right now because we know that we can't operate at the same capacity or time frame that we once were able to, because there's also a number of HR pieces as well. Like, we've got people who are not able to come to work because of pre-existing health conditions. Maybe we've got people that, and I'm going to point to a couple pharmacies where we've got people who've gone on mat leave. We've got people who have become sick, and maybe they can't come into the pharmacy, but they're not so symptomatic that they can't continue working. So a few things that we've seen across different practices is, number one, they changed their hours to which people can pick up and have delivery. And so what they're still doing is people are coming in still at the regular shift, but they're not seeing patients or having pickup until later in the day so they can get their work done. And then they're prepared for that crush of people kind of rolling through. And so shortened hours for pickup, but normal business operation hours, functionality within the pharmacy. So the regular shift still exists. But then what they've done, and this is a really unique practice out on the East Coast, where what they did is they took the staff and they said, okay, we're taking 50% of you and you're on week 1, and the other of you is on week 2. On week 1, you are going to work your same number of hours that you would get within a 2-week period, but you get 1 week off, 1 week on, 1 week off, 1 week on. And so effectively turning them all into like a firefighter shift. So we're separating out staff. So if someone on one of the staff becomes infected, it doesn't affect the entire practice. We can then say, okay, you've got it. We know who it is. Let's see how the rest of the staff goes. And so they're able to support each other with the splitting of staff. We saw someone in Calgary who just reduced their hours and said people are going to be on this sort of different rotating schedule. But then we've seen people give staff a computer and a way to actually continue accessing the computer database. And so they'll be doing things like uploading prescriptions, checking prescriptions. They might be doing counseling. They might be following up on refills. They might be doing other work, but from home, so from an off-site position, which is absolutely amazing because a pharmacist can still counsel on medications over the phone, especially at this time frame. And so we're seeing pharmacists who are now working from home who they're not actually in the pharmacy, but there's a pharmacist checking prescriptions, but they have a separate pharmacist doing all the consulting, counseling, phone calls, follow-up. And so we're seeing this sort of dynamic of who is needed on site, who's not needed on site. Anyone off site, we're going to give you access to tools and get you working from home. And then I'm seeing this, and I'm getting phone calls from so many pharmacists who are like, okay, this is my week from home, so I'm doing all of my phone calls, my catch up on formulations, et cetera, development, and then they're just either emailing it or sending it in. And so we're seeing the digital age really come alive, even in pharmacy, which we're usually practicing much more hands-on. That's that division of labor. So that clinical expertise is becoming even more widely recognized, especially in these compounding pharmacies with these niche practices, because guess what? Consultations are still happening, and people are doing not telehealth, but they're doing a version of it where they're doing Zoom meetings and they're still doing their HRT practice, which I find is amazing. Pain practice. Wound care. They're actually taking their phones and saying, this is what my wound looks like. Fantastic. This is what we're going to do. I'll have it sent to you, and this is how we're going to continue with the care. So it's almost like, like I said, these innovative practices are being translated to the digital age of patient care, and we're still having this massive impact within the community.
So Amanda, I'm going to switch things over to you. Sebastian talked about the management of shift workers and having personnel, obviously in very different buckets, whether it's maternity leave, whether it's individuals that unfortunately have been impacted and been forced to quarantine, but most importantly, just management of staff in general. What are some of the things that you've seen and some of the information that has been released either provincially or potentially federally?
Well, one of the opportunities that is available is called a work sharing program. Unfortunately, it isn't an easy thing to set up, but it is an opportunity for those that are doing the split shifts. So it's a reduced hour type program, and there have been some adjustments made to the program in response to COVID-19. So the big things there is it's at least 2 people. It has to be a reduction in hours that they accept. It has to be, now this is when you're getting into your Employment Standards Act. So you have to ask their permission. You can't, as an employer, tell them they are doing this. But the reduction in hours can be anywhere from 10 to 60%. And and the time frame that's available has been extended because of COVID. So anyone that wants more information on that, it's the application and the details on the program are available through Service Canada. So that's one of the options that they have. The other is to pick up on what Sebastian was saying, is that if you have the staff levels to be able to split into 2 shifts, using that time at home, like Sebastian was talking about, we've also heard people, NAPRA is still out there. So if the staff members are at home, this is the time that they can be writing those SOPs, or if it is learning, maybe they can access some of the PCCA education online, or if they haven't done them yet, the risk assessments. All of those things can be done from home. And we've also, Sebastian did mention it, but the outbound patient refill call-outs this is an opportunity for those of you that aren't doing patient follow-ups. If you've got the time to do it, now's the time to roll that program out.
I think that's been probably one of the biggest universal wins everywhere. And depending on whatever country you're in, this is such a great opportunity to use that time for patient profiles, patient follow-up programs, and developing a lot of that content now where there is a bit more time spent, or time available, I should say. So you can hopefully try to dedicate a lot of your resources towards some of those practices. Thanks, Amanda. In regards to just overall your mindset or your view on kind of next steps, we are in a position right now to talk about things a bit more positively, knowing that I think it's safe to say we're more towards the end of this beginning part of our isolation phase. And as we reintegrate and staff is obviously looked at in a very different way, both operationally and from a human resources point of view, what are some of the next steps that you foresee for pharmacies as they begin potentially to welcome more staff in, or on a more positive note, maybe welcome patients back into the pharmacy as well?
Thanks, Mike. That's a really good point. The concepts that have come from this with social distancing aren't going to go away anytime soon. So as an employer, it's our responsibility to make sure our team members feel protected and informed about what's going on. So I know here in our building, we've developed some resources for our staff in terms of workplace conditions to ensure a safe and healthy work environment. That is part of our requirements under the Labor Code. So I'm going to share a lot of what we've developed on the PCCA resource page, the COVID-19 resource page, so you guys can edit that yourselves for your own team members. Also putting up any signs, just your precautionary signs outside, do not enter if you have any of these symptoms. So we have a screening poster that we have available. We'll put that up as well. And the third thing is we've implemented a temperature control procedure here. Now that, as an employer, you do require consent for, so we consent forms for. We have a template available that you guys will have access to. And it is a medical record, keeping track of that, so only a team leader would have, a manager would be able to access that information, and if it's going to be stored, it should be stored in the employee file or somewhere that the employer and management have access to only. So those are, in terms of an employee standpoint, those are some things that you can do. But the economic response plan, there's a couple different wage subsidies that are also available to employers in Canada, to small businesses. One of them that they talk the most about is the Canada Emergency Wage Subsidy. That is the one that requires a 30% reduction in revenues, and how that's reported You can, again, check out that's CRA. You need a My Business account to be able to apply for that, but it's basically comparing last year's revenue to this year's revenue. And if you've had a 30% reduction, you would qualify for this subsidy. It is there's a second subsidy that is a temporary wage subsidy or small business wage subsidy. It goes by both names. And that one is related to your deduction side of your payroll. And it is, again, from the CRA, so it is Canada Revenue Agency. It is something that you can apply for at income tax time as well. So even if you don't do it right now, you can. It's retroactive. So those are the biggies. And of course, if there's quite a bit of credit options, small loan availabilities out there as well. So this is an opportunity to gain access to credit. There's two different loans, and one of those has a requirement on a payroll size, but there's lots of information available. I'm going to put all of these resources up on the COVID-19 page so you guys can access them. But there is also a webinar from a national law firm that is very informative. So I'm not endorsing them as a company, but there's a lot of great information on there for those of you that need more.
Yeah, it's so important to note that things could be very, very different at a provincial level, and getting some insight at a federal level becomes so important. We saw that also with our member briefings in the United States, and this is why it's so important for how we roll out this information in Canada. But thank you, Amanda, for expanding on that. Most notably, our COVID-19 resource page. I cannot enforce enough the importance of the information that is found within that section of our website, www.pccarx.com. And obviously, you've found this video content today. So my presumption is that you've also landed yourself on the COVID-19 resource page, but it is constantly evolving, constantly updating. So we'd like to remind all of our audience, whether you're a member of PCCA or not, this is public information on our public domain. So very important to note that it'll be consistently evolving, especially as we phase into the month of May and potentially later, some of the things that are available to pharmacies. I know Sebastian talked about hand sanitizers. A lot of the information that was shared was based on the World Health Organization, and a lot of the information was U.S.-centric. However, as it pertains to Canadian regulations, we'll try to do our best to make sure that all of our audience is aware of some of the changes in place. Sebastian, I'm going to move things back to you for a sec and maybe switch gears into some of the topics relating to nutritional support, drug nutrient depletion, and seeing the fact that a lot of pharmacies had that minimized foot traffic over the last month and a bit. And this obviously has repercussions on a revenue stream as it pertains to being a pharmacy. So we obviously are very cognizant of pharmacies making money and being a profitable entity, most notably some of the sales that are dependent on their front lines and some of the items and very important nutritional products that are used for either immune support or for drug nutrient depletion. What are some of the things that maybe you can discuss as great ideas, as potential pearls that are so important for pharmacies really in this stage of the game?
This one actually applies to not only our patient population, but also to other healthcare workers, as well as to our staff that are in our pharmacy. And I'm going to kind of step onto a weird little platform for 30 seconds, and then I'm going to step off and talk about those ideas. I think effectively it goes back to the fundamentals of underpinnings of health is if your immune system in any way, shape, or form is compromised, it will now be exposed in this scenario. The risk factors range anywhere from obesity to pre-existing pulmonary issues to hypertension to diabetes to autoimmune disorders. And so most importantly, for anyone that has any sort of pre-existing condition or nutrient deficits should be addressed almost as like, oh man, if you get this, you're in real trouble. It's the erosion of that safety net of, hey, we can catch you. The coronavirus is literally just it's pulling away any of that safety net and saying you're at much higher risk. So anything I'm going to talk about is going to be immune support, making sure you're going from that point of maybe kind of healthy to possibly even get into the world of fit realm. And so that is fundamentally 80% of all health-related conditions can be attributed to nutrition, then to exercise and sedentary conditions, and then immune dysfunction and insulin dysfunction. And so some of the things we can manipulate through nutrition and supplementation and still flesh out part of our bottom line, because we can provide that nutritional support as well as immune support and other drug support. So I'm going to step off the pulpit now, and then I'm going to go back to actually addressing your question. Nutritional deficiencies and immune support almost go hand in hand in this world. Zinc, magnesium, vitamin D, vitamin C. I cannot stress enough how much literature is being generated about those particular molecules. And those are supplements that you can have in your front store that you should be recommending to virtually every patient that you see getting a chronic disease-filled medication refill. Hey, do you have your vitamin D? Hey, do you have your zinc? Hey, do you have your vitamin C or magnesium? And it's not a do you need some? It's do you have some? Because everyone needs it. And if they've got a chronic disease state that they're being treated for, they're the ones at risk that definitely need that support. Zinc, I cannot stress enough how much information is out there. There's all sorts of options, but any zinc supplement should effectively be going into, that should be offered to every patient. Vitamin D, especially in Canada, we still haven't seen the sun get strong enough. We're just hitting that point where the sun is going to become stronger and start seeing that production. But people are still self-isolating indoors. Their vitamin D levels are low. A great vitamin D supplement should be offered to every patient, regardless if it's for luxury medications or accessory medications, or if they're just calling and saying, yeah, hey, do you have some polysporin cream because I cut myself? Hey, do you have any vitamin D at home? Are you taking enough? Vitamin C, there's so much literature about that in their treatment as well as their offsetting. The information there for immune support, I cannot, these are the four top ones. And then finally, magnesium. Magnesium deficiency cuts across almost all populations. And we can actually see a relationship of magnesium to sequestering of other molecules in the body. Those are the four foundation cornerstones of supplementation. Then you can get into the other ones that are going to be along the lines for boosting immune system function. So echinacea, curcumin, making sure that your stress levels are kind of being contained. This is the one that everyone's forgetting about, is like, man, how many people are complaining that they're not sleeping at night because they're stressed out and they're worried about what's going to happen next? Melatonin, some sort of calming agent. I know that we've got Seracalm and Loracalm and all these different products. I would be looking at those ones for so many patients that are complaining about sleep issues and stress issues, because stress will actually suppress the immune system. It takes away your ability to fight infection and hold off. If you are afflicted, it can actually be kind of a derailing agent. If you're not sleeping, your immune system will become dysfunctional very, very quickly and can actually implicate other health issues. And then finally, if you're starting to see people who, when they get into bad sleep patterns and their stress patterns are going, their nutrition goes out the window and all of a sudden they're not taking their supplements. So anyone who's getting a sleep aid, anyone who's calling and saying, I need some anti-anxiety meds, anyone who's calling and saying, yeah, I'm just feeling out of sorts and I'm really worried about this. My anxiety is being used. So all of your antidepressant medication patients should be looked at as, hey, we should be caring for them a little bit further, because I promise you they're feeling the effects of what's happening in the world a little bit more than almost everyone else. They're already on edge. They're already anxious. And so those nutritional supplements can become even more important for those patients in making sure that they're feeling at their best health in light of what's already going on in their life.
Well said, Sebastian. I think it's a great opportunity, especially for PCCA members, to look into our privately labeled nutritional line called Pro Wellness and the array of products that we do carry as potential add-on, not necessarily only for nutrient depletion, but also as just a standalone product that is unique to PCCA members, and the ability to be sold and offered in conjunction with a lot of the medications that are being dispensed, both through curbside delivery and through home delivery. So it potentially acts as an extra revenue stream. I'm sure a lot of pharmacies are already doing it. I think it's a tremendous opportunity for those that wish to capitalize and potentially add on. It's almost one of those upselling features like, do you want fries with that? Well, instead of fries, you're maybe getting vitamin D, melatonin, vitamin C, and zinc. So there's a lot of critical information that you shared, and I appreciate you doing that for our Canadian audience.
I was just thinking about one more point, Mike. Some people get really distressed because they have to take 5 different vitamin nutrient supplements. One of the things that I would recommend as a pharmacy right now is if you've got the extra bodies on hand, make a supplement pack on a month and make them, here's your 4 or 5 supplements already in a bubble pack. I'm going to send it to you, and set up a price of that monthly pack, break the bottles. And so they can buy 1 month at a time if they feel they only may need it for 3 months. That's all they want. I just want 3 months. I don't want to be investing $700 in vitamin supplements because people freak out about that cost. Give them the easiest option into getting into that healthy nutritional supplement, and maybe that residual continues after this. There's a whole bunch of different ways of doing it and saying, what do you need? What do you want in this pack? And nutritional supplement packs at this point, if you're not doing that in your pharmacy, that would be the first thing I would pick up tomorrow.
In terms of branding and visibility, one of the core concepts that we've been trying to teach, trying to educate, is really the ability of creating a social media platform for the pharmacy. And I think now is probably more important than ever to have a social media presence, so you do have the ability to communicate directly to your patients. Let them know what's being offered at the pharmacy, your hours of operation, the ability to how to get your medications, but most importantly, as it pertains to nutritional products, the ability to have maybe an Instagram account or a Facebook page where you do have a lot of your patients that would visit you on a normal basis from a virtual setting. But this is something that we've been preaching for, I think, quite some time, at least 4 or 5 years, if not more. Whether it's been part of our C3 presentation, I know it's something that we used to do very, very frequently in Canadian C3, is to have a dedicated time spent to marketing and the creation of a social media account, so you do have the ability to communicate with your patients. But most importantly, even with some of the marketing seminars that we've done over the last few years, it's been also reinforced, and we've been giving some tips and tricks to those that are responsible for sales efforts within the pharmacy level. So I know a lot of that content is not being shared on the screen right now. What I would highly encourage all of you that are listening is to reach out to your sales representative. We have sales representatives from coast to coast. You all know them extremely well, and if you don't, I would definitely just reach out to our customer service department, and we will put you in contact with our sales team to give you a lot of the information to create a social media presence, and hopefully now still have the ability to communicate with them on a daily basis. And I would say there's no better time than in a crisis like the one that we're in to have an additional line of communication besides just maintaining the internal calls and speaking to people over the phone. Now is the time to set up potential email campaigns, Facebook campaigns, and things that can get the word out. So if you do need that additional content for how to get started, we do have that information. We highly recommend that if you do not know a sales rep at PCCA, contact us at customer service at pccarx.com or call our 1-800 number. But most importantly, definitely try to reach out to our sales team. That's what we're here for, and really try to support you in this time as you consistently worry about trying to improve your revenue stream. This is something that PCCA can definitely assist with.
Mike, I'm going to jump in behind you on this one and say the opportunity to become not only a site of information at this time. This is what people are just searching for any sort of legitimate information that is coming from a healthcare professional. It seems as though there's so much information that's churning through every news cycle. Every 15, 20 minutes, there's something new. And people are looking for a legitimate, sensible digestion of that information. And we're seeing a few pharmacies really stepping up, and they're sharing information. We're seeing a few specific innovative compounding pharmacies have really gone the extra distance, and really they're the ones broadcasting good, sensible information and how it actually pertains to people's health. And it's an opportunity to really connect with the community, and building that community relationship is going to be building residual loyalty after this is all done. I can't tell you how many people say, you know what, I got the information from you. I trust you. I want to get it from you. And so building that right now could be key to future success. So for the people who are at home, I would be like, that would be job number one. Get our social media going, get us in front of this, get us to become the voice within our community that is recognized as a leader, as well as sensible, legitimate, trustworthy information.
I'm so happy that you brought that up, Sebastian, because it's something that we've discussed offline, is what is a pharmacy's position at this point, and being the bearer of accurate information and delivering that information on a one-to-one basis is paramount, especially when all this is over. They will remember who you are within the community. You positioned yourself as a leader, as a healthcare professional, and working in tandem potentially with your physician more so than ever when an opportunity arises to present yourself as a frontline dispensing agent for compounding medication or regular medication. Now's the time to position yourself at the patient community level. So thanks so much for reinforcing that, because I know that did come up in conversation with Doug Hoey, one of the podcasts that we recorded, and also with Brian Prescott, who also led a member briefing as it pertains to financial information. So thank you for recapping that idea, because it's more important than ever before.
I'm sure Amanda has a couple of comments here. My thought process is you're having people speak before the full picture is known. And we're seeing this play out, because as soon as someone says, well, wood chips could actually help prevent COVID, all of a sudden there's a run on wood chips. It's beyond ridiculous how fast people are reacting. And so knowing correct information is probably more important than just having the first information.
Yeah, I would agree with both of you. We both said it very eloquently, but I think you're both 100% correct. When this is all over, we as consumers will remember those that brought value to us during this time, and no one is more trusted than the pharmacist. So you guys have a lot of opportunity here to build that value. I will issue one caution. When you're talking about COVID, just be very careful not to make any claims. I know there's been a few naturopathic products that have been featured in the media for doing that. So just be very careful what you put in print, and to really avoid making any direct claims for preventing or treating coronavirus.
It's a great point, Amanda, that you brought out about Health Canada pointing out these naturalceutics having claims attached to COVID-19. In compounding, we have to be very cautious on how we're presenting information to physicians and to patients, especially if we are going to be in a social media page scenario. That can be deemed as making a claim about drug efficacy. Presenting literature is very different, and making a recommendation for the health of a single patient is distinct and in a doctor communication scenario. And that's, Health Canada has got very clear rules about this. If you're going to make a blanket statement about how something works, if there's not literature and studies to support that recommendation, it's going to be you on the horns of that investigation by Health Canada. And Health Canada is moving quite quickly on these. So if you do come across information in an article and you want to present that, it is best just to present the information and say, do you have questions about? Have you heard about this? Would you like to know more information? Like I said, and I'm going to use this because it's completely inaccurate. Hey, wood chips will cure COVID-19. If you make a statement like that, Health Canada will be knocking at your door. Just because we've been given granted extra powers and the ability to dispense and to do all these things, claims are still a big, big no-no without the supporting literature and an indicated drug product. And that's not our world. So be cautious when making recommendations to physicians and patients and how it's being broadcast and what you're putting in print.
I'd like to reiterate that wood chips have no impact on COVID-19.
None whatsoever. Wood chips don't work. It was a fake example. Please do not eat wood chips.
Thank you, Sebastian, and thank you, Amanda. I think that the goal of this recording was not only to appeal to those that listen to Mortar and Pestle, our PCCA podcast, but also to give our Canadian members a better indication of some of the things that we've kept our eye on. And I know that Sebastian is more tapped in, and so is Amanda, to a lot of these subject matter that we had a chance to discuss. So I appreciate both of you taking time out of your schedules to get your opinion across and to also mention some of the most important things right now that a lot of our members are looking for. This gives the ability to us to communicate directly to our Canadian audience, and could not be more proud of what we're doing north of the border as well. So thanks to the both of you for assisting and for conducting this video log of A Mortar and Pestle, a PCCA podcast edition. I definitely appreciate sitting down with the both of you. I hope it's not the last time, and we might have another opportunity down the road. So thanks so much again for doing this.
Thank you.
I just want to give a shout out to all the pharmacies out there that are doing such an awesome job. Keep up the good work.
Cannot thank you guys enough for what you've been doing, not only in the United States, but obviously in our Canadian capacity. And thanks to all of you who tune in to this briefing, as well as to our podcast. As a reminder, to visit our www.pccarx.ca public page, where you can find critical information relating to our COVID-19 Resource Center, as well as other information as it pertains to PCCA membership, as well as our educational events, as they hopefully will resume at some point in 2020. We also encourage you to follow us on LinkedIn, Facebook, Instagram, and Twitter. And for all of you that do follow along with the podcast, if you do not, please locate our Mortar and Pestle podcast on Spotify, Podbean, as well as iTunes platform. Thanks again for tuning into this briefing. This is Mike Lisio. Thanks so much for listening.